In July of this year, 2022, we saw the passage of the Health and Care Act. And this is the latest in a line of legislation which has seen the NHS repurposed away from a public service, which is publicly owned, publicly run, into something that replicates the American managed care model. And it's taken them a long time to get us to this point. But unfortunately, the system is now being designed to turn a profit. And that involves dividing the NHS up into 42 business-like structures called integrated care systems. These are new public-private partnerships, and they will be given fixed budgets to provide care for a population of 2 to 3 million. And out of that fixed budget, they will be allowed to make profit. And how do companies make profit? Well, they do that by exploiting the staff, employing the cheapest staff, the least qualified staff. But in healthcare, one big way of maximizing profit is through the denial of care. And what we're going to see happen more and more is that services that used to be provided by the NHS will no longer be provided. Such as cataract surgery, you might get one eye operated on, but you won't get the other eye operated on. You might find that joint replacements might be rationed in certain areas. So there will be discretion with these new ICSs on what treatments they provide on the NHS. And on an individual level, the ICS can make a determination that, based on your past medical history, they consider you high risk and they won't offer you the surgery that you need. So you have a rationing of care, you have a denial of care, you have a reduced access to care. We've seen over 100 A&E departments closed over the last decade. We've seen a shrinkage of bed capacity, and that has what's created scarcity. So what do people do? Either they languish on longer and longer waiting lists, or they decide to pay out of pocket and pay for a private operation, or they take out private insurance. So the NHS, as we stand today, is at the precipice of flipping into an American-style, insurance industry-dominated and controlled system. The only way it's been possible to prevent an NHS workforce pushback is to have a mainstream media which largely ignores what's happening to the NHS or presents it in a very harmless way. For example, in 2012, the Act then was presented as putting frontline doctors in charge of commissioning services, which was a plausible narrative, but does not reflect the reality. The reality was to break the NHS up into structures that resemble insurance pools. The other big problem that the NHS has had is the unions within healthcare, the GMB, the British Medical Association. They have collectively imposed an ignorance on their members. They haven't told them what's actually going on to the health service. They haven't told them that soon their employment will be transferred to private corporations. The integrated care system will act like a private corporation. So they're no longer really a public employee. They're controlled by private companies. And those private companies will seek a profit by screwing down their terms and conditions. Now, if it's not the job of a union to explain this to its members, I don't know what is. They've always concentrated on distracting members into debates about funding, debates about cuts in services, but they haven't done their fundamental job, which is to protect the rights and the terms and conditions of their membership. And as a result, the governments have got away with a real terms cut in doctors' and nurses' pay, approximating 30%. And belatedly, we're seeing a grassroots pushback from staff demanding pay restoration. We're seeing this in the junior doctors, we're seeing this in nursing groups. But I'm afraid, as I saw in 2016 unfold before my eyes when the junior doctors dispute, which had kicked off then, and you'd seen a new group of politicised doctors speaking out about their terms and conditions, the British Medical Association actually sabotaged their own industrial action. So rather than linking pay to running a safe, effective and efficient healthcare system, they focused it very much on the doctors not being paid enough, which is a fair point, but it doesn't resonate as loudly as what they could have explained to the public, which is that the health service is being privatized. A key element of that privatization is to keep a lid on the cost of salaries. And who paid the price? The doctors and the nurses, and the unions kept quiet. The situation has got so bad that a recently released report has estimated that there's about 1,000 deaths a month due to the overstretched A&E departments and the waiting times for people who have been assessed to need an admission, a hospital bed. Those people waiting over 12 hours, the numbers are now over 100,000. So the government has so disfigured the NHS that 1,000 preventable deaths a month is not getting the media attention that it deserves, and no politician is being held to account. And the reason the opposition isn't saying very much is because they agree with the policy direction, because we've only got here because there has been a political consensus over the last 40 years to sell the public out and to transform the NHS into a corporate cash cow. I think there's a growing awareness of how private companies are not best placed to be running public services. Just look at the energy crisis affecting the country. So we have large companies, some of them owned by other countries, so they're state-owned enterprises, for example, French state-owned enterprise, EDF, which is running our electricity provision. And they're doing that by charging us and then creaming off a profit which goes to subsidize the bills of French people. Now, on what planet does that make sense? Utilities are a natural monopoly. You don't have 3 sets of cables coming into your house to provide you electricity and you can swap between one and the other. So the infrastructure, the pipes, the wiring, the network was developed by public funding. We can't exist without these basic utilities. They should never have been in private hands. So the public are waking up to how much of a scam this is. They understand how much money is being siphoned off into shareholder dividend and how the obscene payments and salaries and bonuses of the chief executives. Now, that money should be invested into infrastructure. We know also from the water companies that rather than building new reservoirs over the last 20 years or building new sewage treatment works, what they've resorted to doing is maximizing shareholder return and profit and pumping raw sewage into our rivers. Now, translate that business methodology into healthcare, and you can see where this will end up. You will have patients being denied care, preventable suffering and death on a very large scale, as we see in America. So I think the Christmas future for people that we need to convince them of is the American system. And given the cost of living crisis and the blatant unfairness of how the system is running, I believe the public are more receptive now of listening to what we are saying about what's happening to our NHS. In the run-up to the pandemic, the NHS had seen a decade of defunding. So it wasn't getting the matching average historical funding rise, which is around 4%. It was getting closer to 1%. So in effect, there was a 3% cut every year on average funding. And over the decade, that led to services being cut, a manpower crisis. We had 40,000 nurse vacancies, 10,000 doctor vacancies. We had Brexit, which alienated the European health workforce. So we had a recruitment and retention crisis. The NHS waiting lists were already rising. They'd risen over that decade to around 5 million on waiting lists. And then the pandemic struck. How prepared was the NHS for the pandemic? Well, we know it was very underprepared. In fact, the government ignored their own exercise sickness, which reported we didn't have enough beds, we didn't have enough intensive care unit beds, we didn't have enough ventilators, and we didn't have sufficient PPE stockpile. In 2016, the government chose to ignore all those findings, so we entered a pandemic already struggling and ill-equipped to cope. Now, what was the government's answer to coping with the pandemic? Well, it was a privatized answer. They employed an accountancy firm, Deloitte, not a health corporation, and they employed through them the outsourcing giant Serco. So we had a heavily privatized pandemic response, which we know cost 37 billion, and the Parliamentary Public Accounts Committee said that this was a massively expensive waste of money which failed to prevent lockdowns. Now, we know lockdown had many devastating effects on the economy, on people's mental health, on jobs and unemployment. So by the government's willful neglect of the NHS and their active policies of defunding, their response to the pandemic, all these elements share a common theme. And the common theme is to use every opportunity to maximize private profiteering. What they did to general practice is of interest, because at the beginning of the pandemic, you would have thought a rational, logic response was to use the primary care workforce to screen and triage and look after people who may be suspected of the coronavirus. Instead, the government instructed us through NHS England to stand down and to let the response be handled by a telephone helpline, 111. Now, no other Western developed country in Europe had a response like ours. Not only was it grossly expensive, but it led to a lot of preventable harm. The hospitals were pretty much overrun, but more importantly, that standing down of general practitioners had the effect of assisting the destruction of the reputation of general practice and harming the relationship between patients and their GP. And the right-wing media have gone to town on demonizing primary care, distracting us from the root cause of the trouble the NHS is in, which is government policy to defund and to privatize. So whenever government wants to distract attention from what they're really up to, it's also always useful to have a scapegoat. So you can blame the staff, you can blame patients for eating too much or smoking, you can blame immigrants for being a burden on the system. But what they will never do is direct people to the root cause, which is their policy agenda. So unwittingly, the general practitioners in this country, by obeying the diktat from NHS England, have to some extent shot themselves in the foot. This has caused a system which was running to stand still to collapse in some degree. And doctors have found that when things started to open up again, there was a backlog of unmet patient demand, there were delays in diagnosis, delays in treatment, and all that has contributed to really eroding the trust in your GP and the trust in the NHS. And I believe that this was a trap set by government. In order to understand how private companies are going to make money out of the NHS, well, there are different interests at play here. First of all, you've got the insurance companies. Well, they make money by pulling in premiums from policyholders and trying to spend out as less as possible. So if you have a straightforward condition and you're covered by your policy, they'll pay out. But as soon as you become very expensive, they'll look for some reason to deny you the care. Maybe they'll argue your condition was pre-existing before you took out the policy, or they'll make a decision that they don't feel that treatment will work for you. So that's the insurance companies, that's their business model. Then you have the private providers. Now, their business model in this country at the moment is to cherry pick, to take all the easy work out of the NHS, so the straightforward knee replacements, the straightforward cataract operations, all the complex, unprofitable work is left with the NHS. So you end up destabilizing the NHS and sucking resource out of the system. And what do we have left? We have left the big pharmaceutical companies. They make their money by overclaiming the benefit of their expensive drugs, persuading hospitals and health systems to prescribe their expensive drugs, and often they enter into business relationships with hospital providers to give them an incentive, a financial incentive, to use their drug over another drug. And they often produce biased research, which again overstates the value. They suppress negative research, and they never compare it to the best current practice. They compare it to placebo. So it ends up flattering their expensive new drug. So that's how money is to be made. Now, how do people experience this on a day-to-day level now within the NHS? Well, particularly in mental health, more than half the inpatient mental health provided in this country is now privately provided. Even with that, it's inadequate. A patient of mine who unfortunately developed anorexia nervosa, she was 15 or 16 years old. She lived in Kent, but the nearest inpatient bed for her, because she was seriously ill, was in Birmingham. Now, that is not going to help her recovery, with her nearest and dearest being 200 miles away from her. So that is the state of mental health services. Well, that's going to be replicated for all health services. So the unprofitable work, like A&E casualty work, emergency department work, intensive care work, that is not profitable, so the private companies will avoid it. What is left of public provision will be limited. That's why they're closing all these A&E departments. And what we're left with instead is the profitable urgent care centre model, which deals with a very much smaller range of medical problems, and the very serious stuff, well, either you die en route before you get to the urgent care centre, or you risk dying being transferred to somewhere where you should have gone in the first place, which has been shut down locally. And if you do survive the trip, well, because your treatment was delayed, your recovery will be much longer, and there might be more complications. So ultimately, the patients are going to pay a price out of their pocket, potentially, financially a price, but also a price with their health. Worst case scenario, they die or they suffer preventable damage. My advice to people is to take an interest in what's happening in the NHS. When you watch reports on BBC or ITV, you need to be skeptical about what you're being told. You need to question what is the purpose of what you're being told. Is it to undermine the NHS? Is it to paint the NHS as a basket case? And are we being nudged to accept top-up health insurance? Because that's normally the agenda. No doubt there is a crisis within the NHS, but the solution isn't to jump out of the frying pan into the fire and copy the American system. If you're a member of a union, particularly a health union, you need to be asking yourself, why are your union leaders not explaining this to you as I have just done? Now, either they're ignorant, incompetent, or worse, they're quite happy to go along with this. Either way, as a member and as an NHS user potentially, you need to be putting pressure on your union leaders to do the right thing and defend the NHS. If you're a member of any civil society or a charity, particularly charities related to healthcare, again, why the silence? Why don't groups like the Alzheimer's Society or the Age Concern, why aren't they defending the donors' money and the interests of the people they're supposed to serve by highlighting what's happening to our NHS? So the public have a huge role to play in terms of putting pressure on political parties, but that's of limited value. I think we need a grassroots, public-led mass movement against this betrayal by our politicians, and that involves using unions, civic society organizations, getting engaged yourself, getting engaged with what opportunities are available, like national talk radio stations, for example, to combat the pro-corporate propaganda that we're all immersed in, and to smell what's really happening here and educate your friends and your family, because they can only succeed with the ongoing public ignorance about what is at stake. The last thing the public need is what's happened to our utilities like energy and water, where we are given an appalling service, paying through the teeth, and with healthcare we may be paying with our life.